Hi, this is David Brigatti from the Fort Worth Bone and Joint Clinic. We're going to be talking about a preventative care initiative called O.W.N.S Bones, which stands for Osteoporosis, Weight Management, Nutrition, and Surgery Preparation. We're going to meet Dorothy, who's under our care for her osteoporosis, a common condition where weakening of your bones can lead to fractures and chronic pain if not properly diagnosed and treated.
My name is Dorothy, and I am almost a 70-year-old person. When I was young, I was very, very heavy. And in 2005, I had a gastric bypass. I lost about 140 pounds. I started noticing, that I was losing weight. He said, my doctor told me, he says, we need to start checking you now out for osteoporosis since you have a history of it after you'd lost all the weight. So we did that, and he found out that I did have osteoporosis, and he put me on Forteo, which is a daily injection, and it's only good for 2 years. And then he moved me to Prolia, which is a one injection every 6 months. Contacted my doctor, and they told me about the bone and joint clinic. So I came up here, and I just put my insurance card out on the table. I said, do you accept my insurance? Yeah, no problem. Okay, so that's when I started seeing Dr. Brigatti. I want to tell you how good Dr. Brigatti treated me. He let me have, he said, you call me anytime you need to call me about anything that you have concerns about. And he just sits down and talks to you like you're a human being. That you don't know what you're talking about. He does, but you don't. But he listens, and he explains everything to you in detail. And that's the same way with, and then he started telling me about how they were starting to get in, y'all were starting to get into the study of osteoporosis and everything. And I said, well, good, because I said, my rheumatologist is not doing that anymore. And he says, well, I'll be happy to do it, and I'll give you your injections, no trouble. So I just think that's wonderful because, like I told you before, it makes more sense for a bone and joint person to do it than it does a rheumatologist to give you, to work with osteoporosis. But in the meantime, just to also let you know, with my treatment, I have gone from having total osteoporosis to now I'm osteopenia. But and the physical therapy part of this department, they are always so wonderful. They are so caring and everything. I can't even say enough about it. I love it.